Nashville, and welcome to this edition of Let's Talk About It. I'm your host, Erica Battle. This evening, my guest is Dr. S. Adele Daughtery, and he will be talking about anxiety-free dentistry. Dr. Daughtery graduated over 30 years ago and obtained his MPH from Harvard University. He then completed a series of residencies and fellowship programs from such great institutions such as Eastman Dental Center in Rochester, New York, University of California in San Francisco, University of Washington in Seattle, Progressive Orthodontic Seminars, UCLA, and West Veterans Administration Medical Center. He taught for many years at a local dental school, and he's also traveled all over the world to complete mission trips and lectures, but he has also published extensive articles and books in the area of dentistry. Dr. Daughtery, thank you for being here this evening. Let's give some background information on Feel for Dentistry. Now, when it comes to anxiety and the dentist, those two things go hand in hand. Studies have shown that about 30% of people in the United States do not go to the dentist for the fear of just the dentist, period. They have the fear of the pain, needles, their nerves, drills, and I could go on and on. When you realize that so many people do not want to go to the dentist, something that is needed just as going to the regular doctor, as a dentist, how can you combat the fear of coming into your office?
Thank you very much for having me. You are correct to say about 40 to 50% of the population don't seek dental help because of fear. People do have fear of dentistry, but dentistry has come a long way. Now we can actually see patients and treat them with little or no anxiety. There are a lot of ways we can manage that. We can manage that through, some of them through medication. For children, for example, we can do behavioral modification for children. But for adults, there are a lot of medication that we can use these days that will really work well for them.
When you say that there are a lot of medications, can you be a little more specific? Because when I think of medicine and I think of pain, I think of just over-the-counter medication, and I know that's not what you're speaking of. So could you be a little more specific in what ways that you can treat adults?
Sure. We can sedate and we can give an adult what they call conscious sedation or anxiolysis. We can do that by giving them a little blue pill to take, like the one in this bottle here, and then patient will relax. They will be more relaxed. They are not going to feel as anxiety as they were before. They are not going to be apprehensive. So but they will still be able to feel and tell. They will be able to be conscious of their environment. We can do that. We can also do IM, intramuscular or IV. Give them, when we do IV, when you shoot the medication through their veins, we flush with saline water. And usually we use smaller dosage when we are doing IM or IV than going through the mouth. And it's not the same medicine that we use for the mouth and as well as IV or IM.
Okay, you mentioned a word, anxiolysis. Specifically, and I know you kind of gave me a brief overview of that. What anxiolysis, what is that?
It's a pharmacological state of consciousness whereby you pharmacologically induce patients to be in that state of consciousness. They will diminish their anxiety level, but it will facilitate their coping skills. They will retain their faculty, and that's usually the first stage of treatment for managing people who are anxious about dentistry.
Okay, so you mean to tell me that dentists are using drugs to kind of achieve this anxiety-free state?
Yes, we do that. We do that. And like I mentioned before, it's so simple. We use a blue pill. Usually, if you are going to do oral sedation, for example, you give a patient a blue pill to take in your office. And if you, maybe down the road, if you ask me questions about the requirements, and we'll go over there. But we give them that little pill. They take that in their office, and people monitor. We monitor them until they are more comfortable and relaxed. That's when we actually do the work.
So you mean to tell me that I can come into your office after taking a little blue pill and I can just relax and have no fear whatsoever about the procedure that is about to go on, and I can just kind of chill out and be like, all right, my dentist has this, and not be tense or anything, but just be really calm. And I won't say the word enjoy the process, but I can rest assured that my nerves will be so relaxed that I won't be so tense where my dentist can't do his work.
Yeah, you have to take the pill at the dentist's office anyway, and generally we ask you not to eat or drink for 8 to 10 hours before the procedure, and that you bring somebody with you that will come with you. That person will be considered a companion. We give you that blue pills after we've taken. We will review your medical history again with you. We do the vital signs. We take the vital signs in office, and we monitor you constantly through the procedure. We give you the blue pills, and then we bring it to the dental chair. You sit in a very comfortable dental chair with loose clothes. We cover you up with a nice blanket, warm and toasty.
And of course, if you need any additional information about how this process works, you can call Dr. Doherty's office at 615-851-4744, and he will be happy to explain this process in a little more detail. Now, I know that you have some slides that you wanted to show us, the viewing audience, how this process works, just to, kind of give a little more insight to the viewer. Isn't that correct?
Yeah, I do have some video that slides to share with the audience and you, Miss Battle, that tells you the different stages and what the requirements are, and it's very simple, straightforward. It's really education. I thought your viewers will like them.
All right. Well, let's go ahead and see those slides.